What's going on, guys? Tony Maritato here, and I'm going to do a review of a massage gun. This is an off-brand. It's not the most popular brand. It's one that I found on Amazon. I did buy this. This is not an endorsed video or anything. So this will be an unboxing video also. Let's see what we've got. We've got a little carrying case bag. We've got our instruction manual. Here is the device. Now, I don't know if it comes charged or not. At first glance, it feels pretty solid. It does not feel like it's poor quality. It comes with a little charger. Okay. So it does have a little bit of a charge. There's a button on the back. Well, I got it going. I don't know how to stop it. There we go. Okay. Let's see what we can do. So we have, looks like 4 little attachments. The main one I think most of you are going to be interested in is this ball attachment. Let's drop it in there. Let's turn it on again. Okay. If I give it, so if I just let it touch, so right in here, if I just let it touch, it seems to be okay. Very gentle pressure. It's moving the skin. I wouldn't say that's necessarily doing much deep. If I give it any kind of pressure into it, if I start pushing, I lose, it stops. Let's see if we hit a faster speed. Same thing, if I give it any kind of pressure, resistance. So if I stay super light, I'm just barely getting through the skin, I can feel it. But if I was looking for some sort of deep pressure, if I was looking at something that was going to affect kind of the quad, I guess I can feel it. So I'm literally just letting the weight of the gun work on that tissue in there. But if I apply any pressure, instantly the machine stops. Okay, let's see if we plug it in, if we get any better result. All right, let's see what we can do when we plug it in, see if that changes anything about the pressure. One problem, it's a pretty short cord. Same thing. And so if I just go light pressure, I'm gonna feel it. As soon as I start to apply, I don't know, maybe 10 pounds, 15 pounds, it stops. Let's see, we've got 1, 2, 3, 4, 5, 6. 6 speeds. Let's go to the highest speed. I mean, I think it would be enough. If somebody's looking for some sort of kind of superficial stimulation to reduce a little bit of the pain, the sensitivity, I think you might enjoy the sensation. You know, for somebody who's experiencing some IT band symptoms, I can feel it. I won't say that it's the same as a $300 massage gun, but for something coming in well under $100, if I'm not looking at getting really aggressive, if I want something that's just kind of maybe facilitate some circulation, again, I am literally just letting the weight of the gun do the work. Certainly, this is not designed to, quote, break up scar tissue. It's not going to do that. It's essentially going to stimulate some of the touch receptors within the skin, deep to the skin. I can make a case to say how it's going to cause some beneficial chemical changes, but really, you know, it's about sensation. That's about it. The mechanical pressure is not enough. That I would say, if you're looking, if you're somebody who really likes that deep tissue, this isn't going to do it. This is going to be more kind of pleasurable, superficial. So, all in all, I think it's probably worthwhile. For those of you who are wondering about like post-op rotator cuff repair, upper trap, cervical issues, same thing. If I get it going, I'm going to put it on 3 and I'm going to come into this area. And so now from here, I can let it kind of sit on that upper trapezius muscle. As I go a little bit further to the back, I've got it sitting on the levator scap. I can turn and do repeated rotation, repeated side bend, a little bit of forward flexion. One of the ones that I like to do to relieve tension in the upper back and neck is to do active scapular depression along with the pressure of the massage. But one more time, I'm not pressing down, I'm allowing the weight of the device and the movement to produce the sensation that I'm experiencing. So, and then like most things, you know, so now it's like, oh, it's a little itchy, I want to scratch it. But to me, that's a sign that the area is just not used to that kind of sensation. So now it feels a little numb in a good way, feels a little warm, feels a little tingly, certainly a little bit looser. I'm going to play around with this over the next couple of days. I'll share some more videos with you guys and I'll let you know whether, for me, this is something I'm going to keep in the clinic or not. Guys, thanks as always. Like the video. If you want to see me review and play around with more products, just let me know. I'm happy to go out there and buy them, and this way we can have an unbiased review and let you know what I think of it. Guys, I'll catch you on the next video.